Hi everyone! Thanks for tuning in to the NUS Nursing Research Podcast series where we feature the latest works of our brightest minds. I'm Dr. Jocelyn Chew, a research fellow at the Alice Lee Centre for Nursing Studies. Here with us today is Dr. Piyanee Yobas, a tenured associate professor at the Alice Lee Centre for Nursing Studies, National University of Singapore. Her research focuses on the development and implementation of psychological interventions and mindfulness-based interventions and has been awarded multiple grants to support her research work. So our topic for today is digital mindfulness for cancer survivors, where Prof Yobas shares about the development and delivery of a digital mindfulness program for cancer survivors. So hi Prof Piyanee, so nice to have you with us today. So I remember during the COVID period, right? I saw this video where you were sitting at this very nice green grass pasture. I believe it's somewhere outside. And then you were teaching everyone, the viewers, on how to perform mindfulness practice, and I found it so zen.
Right. Oh yes, that COVID-19 period was very stressful for many people. And I hope to share the technique of mindfulness with everyone because mindful livings lead to a more peaceful, satisfied, and happy life. So if you try to describe mindfulness in a phrase, I would say, make today the best because today is the best foundation for the future.
Wow, I think that's so powerful. So maybe could you share with us a little bit more about yourself and the work that you do?
Okay, all right. My name is Piyanee Yobas and I am Associate Professor at Alice Lee Centre for Nursing Studies, National University of Singapore. And today, I'd like to share one of my research projects which is relevant to my program that I developed, Digital Mindfulness for Cancer Survivors. And the application of mindfulness has been expanded around the world. And mindfulness refers to paying attention to a current moment with a non-judgmental attitude. And there is research that's showing that mindfulness is linked with better psychological well-being and quality of life.
So I know that your work focuses a lot on tele-mindfulness for cancer survivors, right? So what do you think is the most important concern of these cancer survivors?
So cancer survivors encounter substantial challenges which affect their physical and mental health. So having a digital program is perceived to be beneficial for cancer survivors. Such an online platform allows cancer survivors to access the intervention anytime, anywhere, and helps participants to overcome challenges concerning distance, available time slot, and physical limitations so that they can turn up to the session. And also think that evidence-based practice play a critical role to guide quality care, and including for all clients, including cancer survivors. As a nurse, it is important that I conduct research to generate empirical evidence to guide clinical practice.
So how do you come to mindfulness as a topic for your research?
Right. Actually, this project was initiated by Professor Emily Angs, head of the Alice Lee Centre for Nursing Studies, who allowed me to conduct face-to-face mindfulness intervention at National University Cancer Institute, or NCIS, at NUH. At that time, it was not a research, but it's just a mini project to help participants. There is 4-session MyCan program was developed and delivered to cancer survivors. The term cancer was changed to a more positive tone. We named the program MyCan to reflect that we can do anything if we set our mind to do so. The original MyCan program contained 4 sessions, which help participants learn about the principle of mindfulness and learn how to use mindfulness practice to manage stress, unpleasant emotions, and unhelpful thoughts. I deliver the interventions and receive positive feedback from the participants. They suggested that the program be continued, and they also asked us to expand the program from 4 weeks to 8 weeks. Therefore, the 8-week program was born.
Wow! Could you share with us a little bit more about how you even started the whole MyCan program?
Okay. At this point, I'd like to present my journey into 4 sections: the past, the present, the process, and the future. Okay. So for the past work, It all started when I received a research grant from National Cancer Institute Singapore under the National University Hospital and conduct research to test the initial effect of the face-to-face MyCan programs. I deliver multiple cohorts of interventions. 61 cancer survivors complete the programs. Results indicated that the face-to-face program had the potential to reduce objective stress, subjective stress, anxiety, depressions, while enhancing perceived relaxation, mindfulness, and psychological well-being. And also participants state that the MyCan program heightened awareness of the present moment, cultivated powerful mind and positive emotion, and promote calmness. So some participants commented that they treated themselves better with self-compassion and embraced loving kindness toward others. Okay? So for now, the present, I have moved up another step. I received an NUS Global Asia Institute NIHA research grant to conduct a randomized control trial. This research aimed to test the benefits of the digital MyCan programs. And this program encompasses 8-week sessions. Each week will cover 2 components, education and mindfulness practice. For the education components, participants learn matters specific to cancer, such as stress, body sensation, emotion, thoughts, communication, loving kindness, and integration of mindfulness to daily livings. So for the mindfulness practice, participants will learn to perform the mindful breathing and body scan practice and other techniques. Additionally, all participants were asked to practice mindfulness on a daily basis for 10 to 15 minutes. And they also asked to record their practice in a mindfulness practice diary. The digital MyCan program is delivered real-time using a Zoom platform.
Wow, it seems like all academics like us should go for your program to manage our stress,
so.
right? So how often do you actually practice mindfulness then?
Yeah. Oh yes, I practice mindfulness for 1 or 2 hours per day, every day in the morning. Yes. So I like to move on to part 3, which is the process. So there's a combination of the human touch and technology have worked harmoniously and very well on this project. The Zoom interface allows group members to attend MyCan program without leaving their home. The real-time Zoom session allows the facilitator to deliver live and interactive interventions. Additionally, group members can communicate via a mobile messaging application as part of the program. With this platform, they can ask questions and receive information concerning the MyCan programs.
So what kind of benefits do you think the cancer survivors can get from this program, and how long does it actually take to feel the benefits?
I see. So actually it depends on participant. I measure skin temperatures, heart rate, oxygen saturation, and perceived relaxation before and after each intervention session to capture the immediate changes. Some participants show positive changes during the 2nd and 3rd session. Some participants show the change later, maybe like 8th or 7th session. Again, it really depends on each participant. So now I'd like to talk about part 4, the future. It is more likely that I will continue a digital mindfulness program. However, the content and structure of the program will be modified based on participant comments on the current program.
Wow, I really look forward to it. So do you think there will be other platforms that may be suitable? Because I know recently there have been a lot of interest in the use of like virtual reality, augmented reality, or even mixed reality, right? So do you think this kind of tech tools would be useful for your program?
Actually, that's a very good suggestion. It's really possible that the MyCan program will be offered on such platform that you mentioned. Could be mobile application, virtual reality, augmented reality, and possible, the artificial intelligence.
Why do you think mindfulness turned out to be useful for these cancer survivors?
There are actually quite a few possible explanations on the mechanism of mindfulness. So first, people maybe they are more aware of the current moment or current emotions. Therefore, they are able to manage unpleasant emotions such as stress, anxiety, and depressions. Secondly, the practice of mindfulness change the body functions and make them feel a bit more calm and relaxed. Finally, the interaction among group members in the group environments motivate members to share experiences and support each other.
Right. So what kind of feedback have you gotten from your participants?
Quite a few feedback. So I would say it can be categorized into three main types. First, mindfulness helps make them aware of the current moment, ongoing thought, and non-mindful behavior. Second, mindfulness practice help improve sleep, promote calmness, enhance positive minds, and let go some negative thoughts. Finally, they mention self-compassion, loving kindness, and integrating mindfulness into daily living.
Right. So you shared a lot about how you use mindfulness in your research program, right? So I'm curious about what is your personal take on mindfulness then?
Oh, that's a good question. Actually, I grew up with the culture of practicing mindfulness, and I am convinced that regular practice enhances benefits. For myself, I practice mindfulness on a daily basis in the morning. My practice lasts about 1 or 2 hours per day. And every 2 months, I visit my mindfulness mentors in Thailand to strengthen my knowledge and mindfulness skill.
Wow, 1 to 2 hours seems like a long time, especially when we are in such a fast-paced society,
Correct.
right? So could you summarize a little bit about what are the benefits that the cancer survivors can gain through your program?
Okay, sure. Yeah. Mindfulness actually has the potential to generate benefits for cancer survivors. And findings from my research show that practicing mindfulness reduces objective stress, subjective stress, anxiety, depression, while enhancing perceived relaxation, mindfulness, and psychological well-being. The more the practice, the greater the benefits. A tagline that you could apply to mindfulness would be, make today the best because today is the best foundation for the future.
Thank you, Prof Yobas, for sharing with us your wonderful insights on mindfulness and how it could benefit cancer survivors. You've been listening to a podcast on digital mindfulness for cancer survivors, part of the NUS Nursing Research Podcast series. With us in the studio was Dr. Piyanee Yobas, a tenured associate professor at the Alice Lee Centre for Nursing Studies, National University of Singapore. I am Dr. Jocelyn Chew. Thank you for joining us in this episode and stay tuned for our next podcast.